Right, right. So I think one of the things that we're probably going to be seeing in the next update is the dietary guidelines. The revamped dietary guidelines are basically recommending people eat more protein. And if you talk to any physician that's treating their patients, if you talk to any dietitian, you will hear almost to a person that nobody is deficient in protein unless you are, having some other really major thing that's affecting you, like malnutrition, an eating disorder, et cetera, et cetera. Most people are not deficient in protein. They are deficient in fiber. That's something that people should be eating more of, but protein we're getting enough of. But these dietary guidelines are recommending people eat even more protein. And while that's probably not a big issue and concern as long as you're watching your saturated fat, I think where we're going to see that in a practical sense is there might be a change to school meal standards to increase the amount of meat and dairy that's on a plate.
Okay. So Staten Islander News is here today with Noah Pramsma. Noah Pramsma is a nutrition education coordinator with the Physicians Committee for Responsible Medicine, a Washington, D.C. based nonprofit organization dedicated to promoting preventive medicine through plant-based nutrition and higher standards in research. A native Vermonter, he does his best to act locally and think globally in both his personal and professional life. Noah completed his undergraduate degree in biology pre-medicine at Calvin University. During this time, he developed a passion for plant-based nutrition and preventive medicine, as well as the ethical treatment of animals and environmental sustainability. He went on to earn a Master of Science in Dietetics from the University of Vermont with a focus on community nutrition and sustainable food systems. Noah's other past professional experiences include as a special supplemental nutrition program for women, infants, and children, also known as WIC, public health nutritionist, policy coordinator for the Vermont Academy of Nutrition and Dietetics, and several roles with the city of Burlington, Vermont, including a term in AmeriCorps and director of a nutrition-focused summer camp with the Parks and Recreation Department. So good morning, Noah. It's good to have you with us.
Hey, so great to be with you. Thanks for having me.
Today what we're going to kind of talk about is the new dietary guidelines for Americans that were just recently released by the USDA. And from the statements by the USDA secretaries, which include RFK Jr. and Brooke Rollins, they kind of co-wrote the introduction panel, and they said, to make America healthy again, we must return to the basics. American households must prioritize diets built on whole, nutrient-dense foods, protein, dairy, vegetables, fruits, healthy fats, and whole grains. Paired with the dramatic reduction in highly processed foods laden with refined carbohydrates, added sugars, excess sodium, unhealthy fats, and chemical additives, this approach can change the health trajectory for so many Americans. The U.S. is amid a health emergency. Nearly 90% of healthcare spending goes to treating people who have chronic diseases. And many of these illnesses are not genetic destiny, they are the predictable results of the standard American diet. A diet which, over time, has become reliant on highly processed foods and coupled with a sedentary lifestyle. But when you actually think about this, it's only part of the picture. And Frank who is a professor of nutrition and epidemiology and chair of the Department of Nutrition at the Harvard T.H. Chan School of Public Health, said of the new guidelines, quote, I think the new guidelines move in the right direction by reinforcing the importance of reducing added sugars and cutting back on refined grains and other highly processed foods. However, there appear to be several contradictions within the DGAs and between the DGAs and the new pyramid. The mixed messages surrounding saturated fat-rich foods such as red meat, butter, and beef tallow, specifically beef tallow was mentioned, may lead to confusion and potentially higher intake of saturated fat and increased LDL cholesterol and cardiovascular risk. These details matter as images and taglines may be more memorable than the nuanced details in underlying texts, and it's one of the reasons why Harvard created their healthy eating plate and the healthy eating pyramid before that. So, kind of wanted to just kind of get your thoughts on all of that and the new nutrition guidelines and how Americans can really be healthy.
Absolutely. Yeah. I think what the Secretaries Kennedy and Rollins are really good at is naming the problem. They have correctly identified that many Americans are suffering from all of these chronic diseases. Where they seem to miss the mark, though, is really in identifying the correct solution. RFK has spent a lot of his career fighting for chemical free world where produce is not grown in ways that involve detrimental farming practices. He's got a whole backstory on vaccines as well, but his focus and the focus of these new dietary guidelines. They do include some helpful things like talking about eating more fruits and vegetables, but they also include eating a lot of the foods that are responsible for the chronic diseases in the first place. Things like animal products, specifically red meat, which, if you look at the new food pyramid, is featured very prominently. So, for someone who is looking for guidance on what to put in their grocery cart, if they look to this food pyramid, they are very likely going to be reinforcing a lot of the same habits that may have gotten them to a not ideal health situation in the first place.
Right, exactly. And the American Medical Association's new guidelines, which I had actually just sent a graphic of it over to Leslie, and I'll put the same graphic here on the screen, basically say that um, cancer isn't a destiny. Like it's not just something that just kind of happens with no forewarning, no reason, stuff like that. So they tell you that you don't want to smoke, you want to limit alcohol intake, you want to exercise as much as possible, and you want to follow a plant-based diet. And that plant-based diet and the exercise and the not smoking and the no alcohol will help to prevent cancer from developing. They do not go so far as to say that it will reverse it, but there is quite a lot of evidence and quite a lot of nutritionists, other physicians, particularly there's a place in that had to move to, I think, Cuba or Costa Rica because they were basically chased out of the US because they were saying that they were curing cancer. And you're not allowed to say that without being,
Mhm.
going through the whole medical channels and stuff like that. So for that reason, they ended up moving to South America. But they were getting really, really good results. And the crux of their diet was no meat, um, vegetables, especially green, dark leafy vegetables, and fruits. And they were actually reversing people's cancer in a permanent way. Whereas, you go into remission and people are like, they don't understand that sometimes remission is permanent, sometimes it's not, and it really kind of depends on what the person does after. So,
Mhm.
yeah, and also if you could talk a little bit about a couple of the studies that you're familiar with about either preventing cancer using diet or reversing cancer that has developed.
Yeah, yeah. Thanks for bringing up cancer because I think for many people, cancer does loom as this really terrifying disease. Cancer is among the top five. I think it might be the third most common chronic disease. It is second to heart disease, which is the number one killer. But with something like heart disease, you can track your numbers. So you can go into your doctor's office, they can draw some blood. They can tell you, hey, your cholesterol is high. You should probably do something about that because you are on your way towards heart disease. Cancer is a little bit different. It's hard to always track. We hear about the importance of catching it early. Well, it's a little inconvenient to have your entire body searched for cancer on a routine basis. So I think what scares us about cancer is its unpredictability. And there are a lot of things that go into raising or lowering a person's cancer risk. And so what we try to do is just distill the evidence, communicate as much uh, as much of the information that we do know to the public so that they can reduce the risk as much as possible. So you were talking about the American Medical Association's statement that was specifically on breast cancer. So people don't realize that a plant-based diet is actually one of the most powerful things you can do for lowering your risk of breast cancer. We have a whole national campaign. If you've ever been walking through a park in September or October and heard a bunch of drums going, that may have been some of our friends trying to raise awareness for what you can do to try to beat breast cancer, beat the odds of developing it in the first place. There is some interesting research, I would call it all pretty preliminary, that would to show some benefits of things like plant-based diets and some of the powerful phytochemicals that they have in actually reversing breast cancer. But at this point, I would not recommend anyone disregard the advice of their doctor and try to go it alone with eating buckets of broccoli every day, for example. Um, so ultimately, we know that there's a lot you can do to reduce your risk of breast cancer. So that's what we try to talk about with a plant-based diet, maintaining a healthy body weight, regular exercise, avoiding in alcohol. Those are some of the most powerful things you can do. Of course, it's not just breast cancer. Colorectal cancer is another one that's has very high rates, and we're seeing growing rates among young people as well. And we know that there is a really close link between processed meat and colorectal cancer. So the more you can be eliminating red and processed meat from your diet, as well as leaning into those plant foods that are high in fiber, that's going to really help reduce your risk. Now, one of the reasons fiber is so powerful is because it helps your food move through your digestive system more quickly. And the idea there is that any toxins or carcinogenic compounds that might end up inside of your digestive tract, if you can reduce the amount of time that they spend there and therefore reduce your exposure, you are like less likely to develop colorectal cancer in the first place. So high fiber diet, which of course you get when you are eating all plants, combined with regular activity, just kind of keeping your GI tract moving along smoothly, that's going to go a long ways towards reducing your colorectal risk of cancer.
Awesome. And now, one thing I just wanted to point out is that some people don't understand what we mean by, or what the secretary means by processed meat. That
Mhm.
does include bacon,
It
unfortunately, for
does,
people who love
yes.
bacon. It's not just spam. Like when people think processed meat, they think the little can of spam, but it's a
Mhm.
lot bigger than that. There are a lot more types of meats that people don't realize are processed. So, like
Mhm.
bacon, all the different kinds of Canadian bacon, regular bacon, all of
Yeah.
that stuff, spam, of course, and sausages
Mhm.
are a big one and actually are one of the more unhealthy processed meats, kind of like you go spam, then sausage, then bacon, like if you're ranking them in like order of how harmful they are.
Yeah, yeah, they're all, slight variations on quite harmful. So yeah, you mentioned some important ones. I would add to that list, most deli meats also have a curing process. Any sort of dried meats oftentimes also have undergone processing. So think your Slim Jims or some of these, bison sticks that you might see in the grocery store checkout aisle. Hot dogs would be on that list as well. Some chicken nuggets are undergo a lot of processing. So yeah, really, we talk about the different types of processed meats. Ultimately, red meat is not far behind it. So we're looking to really just remove as many animal products as possible. We could, if maybe in another conversation, get more into the connections between dairy and different types of cancer. But really, if it's coming from an animal, it is not likely to be reducing your risk of cancer.
Right, right. Yeah, and that's interesting too because there is now a lot of evidence that dairy does cause cancer, and they have weirdly, I guess they've always had it since 1992. I was looking at the pyramids today.
Mhm.
Dairy is its own food group. Like you must have dairy. It's one of the food groups.
Mhm.
It's essential for you, but it's actually not. And there are
Mhm.
things that you can consume instead to give you the same benefits. Like, for example, milk is high in calcium and it's got vitamin D. And they say that you need it because of those things, but it also, you can get those things from plant-based sources and other sources that maybe aren't so high in fat, which a lot of dairy is high in fat also, and have not been shown to cause breast cancer or other cancers.
Yeah, there's a couple important things in what you said right there. I'll just zoom in really quickly on calcium and vitamin D because, yeah, that is those are nutrients people oftentimes think of, especially as it relates to bone health when it comes to dairy. Turns out you get as much calcium in a cup of cooked leafy greens like kale, for example, and it's more absorbable than the calcium in dairy's milk. It's also the case that dairy's milk has vitamin D added to it. It's not naturally there. And so that's really the case with pretty much all dietary sources of vitamin D. It has generally been added after the fact. One of the few exceptions to that is mushrooms. If you buy a pack of mushrooms, leave them out in the sun, that will actually help them develop their own vitamin D. But it turns out you have that same superpower as well. So if you go outside, your skin, when exposed to sunlight, is able to make its own vitamin D. And that is one of the most reliable ways to ensure that you're getting enough. So if you're living in northern latitudes in the winter, a supplement might be beneficial, or be strategic and choose some of those foods that have it added to them.
Right. Oh, that's interesting. I did not know that about mushrooms. And yes, what you mentioned about the northern climates, I think you're in Vermont. We're here in New York with our, when we get 2.5 feet of snow
I was there over the
like the
weekend.
week
Yeah.
before. So yeah, we're not going because when you think about getting vitamin D from the sun, you have to expose yourself to it. Like it can't just be your face. It has to be like
Mhm.
your face and arms and stuff. So yeah, that's not happening right now. But when the spring finally does spring, it will be good for people to understand that they should get their vitamin D from the sun, ideally. And also what you were saying about how it's added to regular milk, if you actually look at in terms of the plant-based milks, soy milk is almost bioidentical to regular milk in that it has the same grams of protein. It also is fortified with vitamin D. I know Silk is. I don't know if every brand is, but I'm pretty sure every brand is. It has extra calcium added, it has magnesium, and it has vitamin A also, I believe. So it makes it exactly the same nutritionally as milk, but it doesn't have that saturated fat and it doesn't have those possibly cancer-causing chemicals in it as well.
Exactly. Yeah. And we spend a lot of time thinking and talking about milk because it is such a huge issue. You know, you mentioned that it was its own food group in past iterations of the dietary guidelines. There's a committee that is usually convened to inform every update to the government's food recommendations. And so there was a really fantastic group of 20 individuals, scientists, researchers, and they put together a report last year that recommended swapping out that little dairy icon and saying you should really just be drinking water for your hydration needs. And dairy can be included in one of the other food groups, but isn't necessary. And that was a really well-informed perspective because there are so many people who are lactose intolerant. It's only by a random mutation that people from Northern Europe are able to generally digest lactose, which is a sugar in milk, into adulthood. And we see this as a huge issue because if you're a student in school and you can't digest lactose, government policy has a big sway over whether you can access some of those non-dairy milk options like soy that you were describing. So we're really passionate about making sure that people who cannot digest lactose have access to good alternatives. And unfortunately, these dietary guidelines don't do much to help that mission. Of course, these guidelines were written by people who have a lot of ties to the meat and dairy industry, people who want to see milk and whole milk show back up in schools and be served to everyone. So we're really trying to raise awareness of the fact that, yeah, there are, millions of people around the world who are not able to drink milk, and they know that it's not necessary. And we think that should be reflected in public policy and, the milk that is being served at schools.
Right, exactly. And actually, one of the things that Leslie had mentioned was that the new milk guidelines, that what is it, the healthy milk for healthy kids or something like that act that
Mhm.
they just passed, actually improves the milk issue because prior to that, apparently, in order for a kid to get a soy milk or an oat milk or something, they had to have a legit, literal prescription from their doctor.
Mhm.
Now, It's just a parent's note, which is a whole lot easier to get your mom or your dad to write a note. And I guess they have these on file in the school, and they're like, well, do
Mhm.
you have the note? And I'll give you some soy milk if you do.
Mhm.
But so that's actually one of the few things that was improved this year is that now instead of having to get a doctor's note to get milk because you're legitimately lactose intolerant, because there are some people who milk will give them a stomach ache, but it's not diagnosable lactose intolerance. It's just sensitivity, and sensitivity and intolerance is not the same thing. So,
Mhm.
like medically speaking.
Exactly. Yeah, yeah. That was the Whole Milk for Healthy Kids Act, which, as the name would imply, is was primarily about bringing whole milk back into schools. And we were not thrilled with that, but the bill had a lot of momentum behind it. So we decided, hey, at the very least, we can get this additional component written into the bill, as you just described, making it easier to access non-dairy milks. So there is more choice now, or at least there will be more choice for students having access both to whole milk, which we know there are health consequences to something like that, but at least they'll also have access to soy milk.
Right. And something else that I did want to mention about cancer is in a sense, all cancers will respond to a plant-based diet. Cancer is a systemic disease. Yes, it appears in one place, but one of the things that they're starting to understand is that the reason it can move so quickly and metastasize, as they call it, is because you have blood. You're a
Mhm.
system with blood in it. It's kind of like, and you're not a car. You're not like a car. You're not componently separated in the way that a car is, where you could take something out and put something back in.
Mhm.
So, in that sense, if you are having something that you know, scientifically speaking, prevents breast cancer, you can assume that it will probably also prevent rectal cancer or lung cancer or brain cancer or other kinds of cancer as well. It's not like breast cancer is a specific special thing and all the other cancers are totally different.
Exactly. Yeah. Yeah. Cancer, it is really truly it is both a class of diseases with unique properties depending on where it arises, but there are also commonalities. And I'll go even a step further and say there's a common way to approach multiple diseases, whether that's cancer, heart disease, type 2 diabetes, Alzheimer's. So many diseases are less likely to plague one's life if they can do certain things, specifically reduce animal products and follow a plant-based diet. That is really a prescription for a long list of diseases that we all would prefer not to have to deal with ourselves.
Right, right. And one other thing that I did want to mention is they talk about in the guidelines nutrient dense foods, including protein. What are some of the nutrient dense protein sources for a plant-based diet? So that you
Yeah.
can get like the equivalent, like you don't have to eat red meat because you can eat A, B, or
Mhm.
C.
Yeah, well, let me start just by pointing out that the new dietary guidelines essentially double the amount of protein that they recommend. Now, if you start with that assumption that every person should be eating 1.2 to 1.6 grams per kilogram, which is, upwards of 120, 180 grams per day, that can make it difficult. Of course, it is still possible to do on a plant-based diet, but we find that people's that health really starts much lower, and there's sort of the basic requirement of about half that for just general basic needs. A little bit above that can be totally fine as well. So we want to kind of take a nuanced and evidence-informed understanding of how much protein a person needs. And once we kind of clear the air there and realize that, there's a moderate amount of protein that we need, too much can cause kidney issues, and potentially even lead to weight gain. Then we can go back to the foods and say, okay, what are the foods that are going to get us there? And if we start with we have our at the physicians committee, we have our four food groups that we talk about that pretty closely parallel the old My Plate graphic from the dietary guidelines. So that's fruits is one, vegetables is number two, Grains, preferably whole grains, is our third category. And then legumes, which would be beans, peas, lentils. That's our fourth category. And ultimately, that we find that is protein in each of those food groups. It's maybe not a widely known fact, but fruit, even though it's primarily carbohydrates and delicious sort of juiciness, does have a small amount of protein. Vegetables as well. In fact, if you ate all of your calorie needs from broccoli for one day, about 2,000 calories worth, you would get nearly 150 grams of protein just from that broccoli. So vegetables can have a great amount of protein in them as well. But ultimately, the way that we structure our meals, it turns out that we end up getting most of our protein from legumes and from grains. Legumes would include things like beans, so black beans, lentils, chickpeas. In a half cup, you get 6 to 8 grams of protein. With something like soy products, that's a particularly high protein food. So if you get about a half cup of tofu, that's going to be 9 to 12 grams of protein. So these are, not huge amounts of food that are easily taking large strides towards your daily goals. For most people, the amount of protein that you're going to need is maybe 50 to 60 grams. So it's really quite easy on a plant-based diet to meet those protein needs. Of course, our bodies are not just made of protein. Like we need so many other nutrients as well. And when you choose animal-based sources of protein, you end up with saturated fat, with compounds that can raise your risk of cancer. But when you eat plant-based foods that have protein in them, of course, you meet your protein needs, but you also get fiber, which helps you control your body weight, reduces your risk of cancer. You end up with all of these, what we call phytochemicals, small compounds that maybe don't fit neatly into one of the vitamin or mineral categories, but have really powerful effects on reducing our risk of cancer, improving blood flow, just overall making us a healthier person. So protein definitely is a big thing, a big block of nutrient needs to be aware of. But ultimately, a plant-based diet is going to be the healthiest way to achieve those needs while also maximizing your health in other ways too.
Awesome. And two things that I wanted to quickly point out. When people think of potatoes, they don't usually think of protein. But in
Mhm.
Ireland, before the potato famine, that was all the peasants ate. And you could see paintings of them, you could see pictures of them. They were not losing weight because of it. And then also there was another study that Mr. Leonardo from the Long Island group, which I forget the name, Lion.
Mhm.
They're the animal rescue group. He pointed out that there was actually a study where they tried to prove the meat industry funded the study, like the Dairy Council, the Cattle Council, and the Pork Council, I think. It might have been the Egg one or something like that. They funded a study to determine that you have to combine plant-based proteins in order to get protein out of them, and that they're
Mhm.
not absorbed the right way. And they actually disproved their thesis. And they found that it didn't matter. You could eat rice in the morning and you could eat tofu in the afternoon and you could eat legumes, and the amount of protein would just combine itself in your body over time. And the whole combining proteins myth versus eating meat, which is complete, turned out to be a myth. So that's something else people should also understand is like if you're eating grains and the grains have 10 grams of protein and you're eating legumes, which have 10, you can combine those and say you just got 20 grams of protein rather than having to be like, well, how much grams of this and that and lysine and all these other things. It doesn't
Right.
matter as much as they thought it did.
Yes, yeah. So you're referring to these amino acids, which are basically the building blocks of protein, and you need them in the right ratios, kind of like a Lego set where you want the exact number of pieces to build the thing you're going for. If they're off, then you can't get there. But yeah, ultimately we found that the old definition of protein quality, which had a lot more to do with data that people were collecting in a lab looking under a microscope, didn't hold up in the real world, and that really the people with the best health outcomes were the ones who were eating plant-based protein. And so when I think about the protein quality that I want to be eating, I would much rather be following the definition that actually leads to the good health outcomes, rather than just a definition cooked up by scientists looking under a microscope.
Right, right. Well, thank you so much, Noah. It was great to have this conversation with you today.
Yes, so thanks so much for having me. I've enjoyed being here.
Thank you so much. Staten Islander News is here today with Andrew Benovi. Andrew is the Director of Government Affairs for the Physicians Committee for Responsible Medicine, a national nonprofit organization dedicated to saving and improving human and animal lives through plant-based diets and ethical and effective scientific research. In this role, he advances the Physicians Committee's policy initiatives at the federal, state, and local levels. Andrew has over 15 years of experience in advocacy in Washington, D.C., where he has successfully advocated for improvements in nutrition, healthcare, and animal welfare policy. He holds a Master of Public Policy degree from George Mason University and a BA in Political Science from the University of North Texas. So, good morning, Andrew. It's good to have you with us.
Yeah, thanks for having me. I appreciate it.
So, I wanted to start with if you could talk a little bit about this new they call it the DGs, Dietary Guidelines for Americans, the DGAs,
Right.
and what they are, what that means for kids in schools specifically.
Sure. So the dietary guidelines for Americans are released by the federal agencies. In this case, it's HHS, the U.S. Department of Health and Human Services, and the U.S. Department of Agriculture, USDA. Every 5 years, they update the dietary guidelines for Americans, and they basically say this is what people should be eating to, live a healthy life and to prevent disease. Um, the guidelines, are more than just kind of the government recommending what people should eat. They actually have direct policy implications. So the dietary guidelines are then used by USDA to update the what's often called the meal pattern, or to update the nutrition standards for school meals. They're also used by the WIC program as another big national nutrition program that uses the dietary guidelines. So what foods are available through the WIC packages is influenced by what is in the guidelines. So these guidelines were just revamped and released in January of this year. And there were a few kind of noticeable changes that I think people have been talking about. One is like bringing back this food pyramid idea. So I don't want to age anybody that might be listening to this or watching this, but you might remember the food pyramid from the 1990s. This one is inverted. There's a few things about the inverted pyramid that are a little bit confusing when you see it. Like there's not really talking about what serving size people should be eating. It doesn't really even kind of say like should we be eating more of this or less of this, depending on how you look at this pyramid. But that really isn't that's really not the big issue with it. But I think one of the things that is troubling, at least for the physicians committee, is the new dietary guidelines seem to be pushing more meat, more dairy, and maybe less so of things like legumes, bees, peas, beans, and lentils. I have a hard time saying that. And as well as other whole grains as well that we saw recommendations in previous guidelines. So the guidelines do say you still need to limit saturated fat, but I think most people looking at those guidelines realize it's hard to limit your saturated fat when you're also pushing people to eat more meat and dairy. So what does this mean for like school meals? So right now, as I say this, USDA is taking a look at revamping the school nutrition standards to meet the dietary guidelines, and the administration is really accelerating this update. Usually, the dietary guidelines have come out, and then a year or two later, we've seen USDA come out with their proposed changes to the meal pattern. This time we're looking at in a matter of months. So we at the Physicians Committee expect to see the proposed rule or the proposed changes to the school meal standards probably in the next probably couple of weeks to couple of months before the summer.
So basically, when you say like they would normally wait a whole year to change now, just kind of like as an example of what this change might look like for a school kid, what they can get today and what they're trying to make it so they can get in 2 months.
Right, right. So I think one of the things that we're probably going to be seeing in the next update is the dietary guidelines, the revamped dietary guidelines are basically recommending people eat more protein. And if you talk to any physician that's treating their patients, if you talk to any dietitian, you will hear almost to a person that nobody is deficient in protein unless you are, having some other really major thing that's affecting you, like malnutrition, an eating disorder, et cetera, et cetera. Most people are not deficient in protein. They are deficient in fiber. That's something that people should be eating more of, but protein we're getting enough of. But these dietary guidelines are recommending people eat even more protein. And while that's probably not a big issue and concern, as long as you're watching your saturated fat, I think where we're going to see that in a practical sense is there might be a change to school meal standards to increase the amount of meat and dairy that's on a plate. It's kind of like, to get into the weeds a little bit on school meals. The kind of, you think of the entree in a meal. That's in the parlance of USDA. That's the meat or meat alternate part of the meal. We could see changes to that is just going to add more meat to that, or to increase the size of that serving, which would definitely be more expensive for schools. And it doesn't really take into account all of the other protein that kids are eating from the other portions of the plate. There's protein in rice, there's protein in vegetables. So, this is kind of like taking a look at what those changes might look like. We might see more meat and dairy being added to school meals.
Got it. Okay. And one of the things that I had learned a couple of years back, probably a while ago, was that some schools were actually, when they would serve kids burgers, they were actually soy burgers, and they just didn't tell anyone. I don't
Hmm.
know if like that kind of like was something where they thought they were eating a hamburger, but they actually weren't. Or it might have been a hamburger mixed with soy to save money, because meat is the most expensive part of any school's dietary program, because meat costs more than all of the vegetables and all the other stuff.
Right.
Um, and then also in terms of religious restrictions, there are Leslie was mentioning that there are actually some laws that are being proposed in New York to make it so that if they have a large population of, let's say, Orthodox Jewish children or Islamic children, Muslim children, that they would have to serve foods that are kosher or halal. And that is not the case right now.
Right. So this varies probably from school to school and from at the local level, but at least talking about state law in New York, is that there isn't a guaranteed option for religious accommodations, just like there isn't a guarantee that kids can get plant-based meals as well. So this is kind of handled on a case-to-case basis. This is handled from school to school, depending on what's best for their students. So the Physicians Committee was supportive of legislation that is still pending. We'd still like to see the legislature in New York pass it. That would ensure that all kids have the option to have a plant-based meal. And often a plant-based meal can also be accommodating to religious meals as well, not just kosher and halal, but certain Jain sects are usually vegetarian or plant-based, as well as Hindu, et cetera, et cetera. So there's a lot of advantages to expanding plant-based options because they can be, in certain cases, also amenable to religious accommodations as well. But right now there isn't really a guarantee. So I know in New York City, certain schools have plant-based options, whether it's one day a week or multiple times a week. But one of the advantages of passing legislation is that kids in Staten Island have the same options as kids in Poughkeepsie, as in kids in Albany, or wherever they're coming from. So we want to make sure that there's some kind of equitable access for kids to have options that are not only healthy. All these plant-based meals, if they're served in schools, are going to adhere to the dietary guidelines. So they're getting the same nutrients as they would in a meal that's not plant-based, but also can be really accommodating for many, many different kinds of diets.
Right, right. And yeah, and what you were saying is about the that there are certain groups that are vegetarian, such as Hindus, Buddhists, some sects,
Hmm.
and Jainism. And also, I've known many people who were Orthodox Jewish practicing people, and what they've told me is that as long as it's not mock meat or mock milk, like fake meat or fake milk, like that's designed to look like meat, and it is plant-based, it's automatically kosher. I don't know if it's the same for halal, but I would assume that it is, because plants don't have those same suffering and
Hmm.
compassion issues, which is where the kosher laws actually stem from. Because we actually had a conversation with a rabbi all about um, how in Torah law they are supposed to limit non-compassionate treatment of animals. And if you look at factory farms, even for a half a second, yeah, it's not a compassionate, not at all. So that kind of brings for them a specifically a religious restriction for some Jewish people who have accepted that. Um, and then I also wanted to mention something that appears to be a contradiction, but just kind of just throw it out there is in New York and in almost every state, kids are required to go to school for 8 years. They have to go through kindergarten through eighth grade. They must. If they don't, they're breaking the law. But when they have to go to school for those 8 hours and they have to have a meal in there somewhere, if there's no law that says that their religion has to be that they have to be offered something that has that meets their dietary restrictions, then they're actually infringing on their practice of their religious religion, unless their parents, because otherwise their parents have to give them a bag lunch or something like that, which kind of brings up the whole income level where there were studies recently that showed that some school kids only eat that one meal that day because their
Hmm.
parents are very low income. So for kids like that, they would be forced to not eat foods that are in line with their religious practices because otherwise they just won't eat. So
Yeah.
I just wanted to kind of touch on that a little bit.
Yeah, I can't really speak to, whether or not this is like infringing on a right or especially religious rights. That's not quite my area of expertise, but I can say at least from the nutrition and from the standard that we're looking at, a couple of years ago, New York State implemented what's called universal school meals. And this is essentially saying that if your kid is in school, they get a free meal, whether that's lunch or breakfast or afternoon snack if they're in after school programs. So really, this idea of like, well, if kids are going to school and we're providing them an education, it makes sense. We should also provide them a meal while they're there. That's like a basic thing. You're if you're honestly if you're anywhere for 8 hours, somebody should be feeding you something. That's probably that's good manners. I will say that. But at least from the law. We said in New York State, I think there's almost a bipartisan agreement. Like, yeah, we should be making sure kids are getting good, healthy, nutritious meals. But in that name, universal school meals, you're kind of like what you're touching on is like, are these meals truly universal if there are things that people can't eat in them? So how are you making sure that everyone has a place at the table? How are you making sure that these meals are truly universal? So one of the things that the Physicians Committee was advocating for is when the government and all me was pushing towards universal school meals, we wanted to say, hey, make sure that there's a plant-based option. That unfortunately wasn't included in what was rolled out, but I do think there's still a chance for whether it's plant-based or other, making sure kids can eat. Because you're right, if there's whatever's being served that day doesn't accommodate for whatever reason, that's something that the parent has to react to. So that's something the parent has to say, here's a lunch, here's a couple dollars to buy something, maybe a la carte or whatever might be that option. And that's not gonna work for all families all the time. So we want to make sure that there's more options available for everyone that's getting a meal at school.
Right, right. And actually, one of the members of your organization had written an op-ed that we published about she herself had an exchange student who was, I don't remember what the religion was, but her restriction was that she could not eat meat. And so
Hmm.
when she went to school, like her foster mom or I forget what they call it, told her, "Oh, it won't be an issue. You'll be able to find something to eat." And that turned out to be not true for
Right.
her. So it's, and in her case, she came home hungry because her foster mom thought that she would be able to eat at school and she wasn't. So obviously after that, then she would have to make meals every day. And there was also something else that the Plant Powered School Meals Act, if you could
Yeah.
talk a little bit about that one.
Sure. So the Plant Powered School Meals Act is federal legislation. It was introduced this Congress by Congresswoman Nydia Velázquez of New York City, as well as Congresswoman Alma Adams. She's from North Carolina. But what this bill will do is it will provide resources to schools to ensure that they can provide plant-based meals. And I say resources because basically that's one of the barriers that schools have for almost anything when it comes to school meals is even if you want to add whatever to the school lunch tray, if you want more X, if you want them to be have more fiber, you want them to have more protein or whatever, you really have to look at the costs and the logistics of getting those foods onto the school lunch tray. Cost, obviously, like producing or procuring more food might be more expensive depending on what the school meal pattern says. But also, not all schools have, have like kitchens where they're cooking from scratch. Some schools are just heating and serving. Some schools are just kind of, it's done offsite and it's come in and then it's served to kids as well. So this bill would provide resources for schools. It's actually a pilot program to set up resources for schools to, if they need more training for staff, if they need to procure plant-based foods, if they need equipment, that those would be provided for them. And another important thing that bill does is it builds upon recent changes to the federal statute to ensure that kids that have whatever accommodations that are needed can get a non-dairy milk at school. So a lot of what I've been talking about today is about like the food that's on a plate, but there's actually a whole separate federal law when it comes to milks. Um, Congress recently made it easier for non-dairy milks like soy milk to be provided in schools. Schools now have the option to just stock that for any student that wants it. But for schools that aren't doing that, there's still kind of like a process where a parent has to provide a note saying that they have a disability, and that is the way that they would get a non-dairy substitute. So this Plant-Powered School Meals Act would say, well, let's make it for special dietary needs. So if you're talking about religious exemptions, if you're talking about kids that are just, vegan, or they just, for whatever reason, besides a disability, can't digest lactose or don't want to digest lactose or whatever, parents can make that decision for their kid as well. So it was great to see Congress change this law a couple of weeks ago. We're working on implementation of that with certain schools, getting more non-dairy milks into school. I think is a better for health, better for accommodations, better across the board. But there's still so much more we can do to ensure that everyone is getting the milk that they need.
Right, right. And we were actually when we were talking with Noah about the Healthy Milk, Whole Milk for Healthy Kids Act, was that prior to that, you had to literally have a doctor's note that said you have lactose intolerance, not lactose
Right,
sensitivity, not you don't like milk. It
right.
gives you none of those things. It
Yeah.
had to be a legitimate doctor's note in order for them to provide it for you. So one of the good things about this act is that it does change that.
Yeah, it puts that into the hands of parents. Because going to a doctor, even as an adult, is takes a lot of time. Imagine trying to do it, for your kid, and to going to a doctor just to say you're lactose intolerant. You don't need a doctor to say that. And there's also issues about is that even a disability or not? That's like a whole other discussion. So we think, putting more of that decision in the hands of parents is a good thing, and just schools can circumvent all of these cumbersome note process by just stocking soy milk right now. They have the ability to do that. So that's something that we're hoping to see moving forward. Love to see it in New York City. Love to see it New York State and across the nation.
Right, right. Because, and actually, something else that Noah was mentioning is that a lot of people from the Northern European countries, they can't digest lactose. And it might not be a real lactose intolerance, but they have difficulty digesting it. And that's just kind of like, for whatever reason, maybe they never had dairy in those regions, so they didn't develop those enzymes and stuff like that.
Right, exactly right.
So, and then if a school today wanted to have plant-based meals with these guidelines in place, the old guidelines or the new guidelines, are they allowed to do that? Or is it like they would have to have that meat and dairy and then a plant on top of it or something like that?
No, schools are already able to provide plant-based options right now, as long as they adhere to the DGA, as long as they adhere to the dietary guidelines. So that's a really good thing. I think it's more about ensuring that where there are students that need these, where students want these, and the school may or may not have the ability to provide it for whatever reason. And we want to make sure that those schools have the resources they need to provide those. So there's nothing preventing schools from serving plant-based meals other than making sure they adhere to the guidelines. But yeah, we'd love to see a wider adoption of this by schools wherever there's a need for it.
Sure. And by the guidelines, do you mean like it has to have a certain amount of protein in it, a certain number of grams, or what would that be regarding to a meal?
Right. Just and maybe that's a little bit of shorthand, but essentially what it means is that USDA puts out standards saying that meals need to have X number of components. You need to have like I said, there's that meat/meat alternate portion of the plate. There needs to be a fruit. There needs to be a vegetable. There needs to also, again, we talked about a milk component as well. And so making sure all of those components are met, and it's a bit complicated, but just for the sake of discussion here, those schools need to meet those components, need to hit all of those components as described by USDA, and those meals become basically USDA kind of uh, pitches in for the cost of those meals. So that's something that schools want to make sure they're being reimbursed for the cost of those meals. And the way that they're reimbursed is adhering to what USDA says should be in those meals. So, yeah, you're correct. So, as long as those dietary guidelines are being met, and as long as those kind of that formula is being met as USDA outlines it, that is what allows schools to serve plant-based meals. They just have to hit those requirements set by USDA.
Right. And is it easy for them to hit those requirements with the meals that they serve if they make them plant-based?
It is, yes. Yeah. There is certain kind of flexibilities that are helpful. For example, making sure that beans are considered part of that meat/meat alternate and not just a vegetable. So there are some things that like could make it a little bit easier because right now schools are already serving in schools are already serving plant-based and vegetarian meals. But again, making sure that there's flexibility allowed there. How are we treating beans? How are we treating lentils? Like making sure those are considered protein and not considered vegetables, things like that. So yeah, there are schools that are already providing these meals for their students. Again, backing up to like there's going to be some changes to adhere to these guidelines. We want to make sure that these changes don't move in an opposite direction. So that's one of the things that the Physicians Committee will be taking a look at is ensuring that one, your school's going to have flexibility to provide plant-based meals, and two, we're not moving in the opposite direction towards, the meat and potatoes of kind of making that the standard. I think essentially it's not even plant-based, or you mentioned religious accommodations. I think overall schools just want flexibility. And schools want resources. So not to speak for schools, but I think those are two things that they want. They don't want, to have to follow complicated guidelines. I think, most schools know what kids want to eat and they know what's healthy. And two, they need the resources to provide those healthy, tasty foods. So whatever changes are coming to the school nutrition standards, whatever changing to the meal pattern, let's make sure that schools retain that flexibility, and let's make sure that there are resources available for those schools.
Right, right. And actually there was one I was reading through the history of the dietary guidelines and there was
Yeah.
one year when they were like, okay, French fries and potato chips don't count anymore. They're not a vegetable, and it had to say that on the chart.
I mean, that's kind of, that's and maybe again not to date anyone watching this, but some people might remember ketchup as a vegetable. So there's a lot to be said about how these dietary guidelines are implemented by the agencies. So that's exactly right. It often comes down to things as minute as French fries as a vegetable or what have you. But they're always these are the kind of things that are at play when we're talking about school meal policy what do kids want to eat? What do schools have the resources to do? And what is actually just what is logistically possible within schools that have, a short amount of time to produce these meals and kids have a short amount of time to eat them. So there's so many different things at play here. So we want to just make sure that schools can retain the flexibility that they have now.
Okay, cool. And a couple of other things. Are the costs of providing plant-based meals versus meat-centered meals, do they turn out to be the same, more or less, for the meat versus plant-based?
Yeah, that's an interesting question. So, we actually talked to some schools in New York State that were doing this, that were providing plant-based meals, and many of them reported that it was either cost neutral or actually there was a cost saving involved. I think an even better example is what you can see in New York City health and hospitals, what happened with the public hospitals in New York City. So they switched to a plant-based by default model, meaning that most meals were just kind of plant-based as is, but you kind of opted in to meat and dairy. So when the hospitals in New York City did this, they saw, a huge cost savings, but they also saw increased patient satisfaction because of that. So definitely, if you're talking about plant-based meals, they can definitely be cheaper than the meat and dairy that they're replacing.
Yeah, I was actually very happy to see that they did that. I think that was like earlier this year or last year. Might have been earlier than that, where yeah, the plant-based meals are the default, especially for people with heart disease, cancers, um,
Right.
and strokes and stuff like they started it, I think, with the stroke ward, and then they kind of
Mhm.
just brought it into the whole thing. And yeah, the patients were so satisfied because they had real chefs and real food, and it really tasted good, and they really made an effort to make sure that it was pleasant to eat it rather than just like, oh, it's a bunch of, it's a
Right.
plant-based meal, so it should taste like cardboard. No, they
Yeah.
actually took the time to make it taste good.
Yeah, and you're exactly right. And it's a little bit of apples and oranges when you're talking about schools and hospitals. But there's some similarities there. You've got people who are eating the meal because they don't have any other choice. For people who are in the hospital, that's what they got to eat. But for hospitals in particular, one of the reasons we were really excited to see that in New York City is because if you're treating people for diabetes, if you're treating people for cardiovascular disease, you want to make sure that you're showing them the types of meals that would, kind of prevent them from coming back to the hospital, kind of prevent, those conditions from exacerbating. And that's why it's really important to focus on school meals. Like we know that kids who are eating healthy meals grow up to be adults who eat healthy meals. If we're setting up kids with healthy meals now, we can ensure that they're not ending up in hospitals for diabetes and cardiovascular disease later. So that's kind of why it's so important to take a look at school meal policy. Sure, it's like making sure kids are well fed, but we're also making sure kids are being seen what is a healthy meal? Like, what does it look like to eat healthy? What does it look like to have, a healthy, balanced meal that, is also accommodating to religious practices or whatever. It's a real education moment as well as kind of a mealtime moment in schools as well.
Right, right. And yeah, like one of the things that I remember when I started going to college is I was starting to notice, and I probably could have noticed them if I got to school at 6 in the morning, the Aramark trucks
Hmm.
coming up and bringing in all their food and realizing, oh, they're not actually cooking this from scratch. And then I found out that they're the same ones that supply the hospitals and
Hmm.
the schools and the elementary schools because those all places that don't necessarily have a real kitchen. Now there are some that do, and you think of the lunch lady, the the
Yeah.
uh the lunch lady with the soup container and all of that stuff, but a lot of the schools don't have that kind of capacity. And so these organizations exist and they can pretty much provide anything that the school wants.
Right. Yeah,
Um,
and those companies are you're exactly right. And those companies are really big players when it comes to institutional foods, whether it's hospitals or whether it's schools or hotels and even correctional facilities are kind of another big customer of theirs. So, we've worked with those companies before to ensure that they have plant-based options available. Because kind of getting back to what we started with, like plant-based options are usually something that everyone can eat. It's when you get into meat and dairies when you see issues with religious accommodations coming up. But whether or not you can eat a certain kind of meat on a certain day or whatever, it doesn't really matter sometimes if you're serving everybody lentils. So that's one of the advantages of plant-based diets is that they're usually something everyone can eat.
right, right. And actually, one thing I wanted to mention also is that a lot of the organization that the rabbi that we spoke with, which I can't remember how the words are arranged now. I forget if it's ethical Judaism, something like that. But one of their pushes is to get Jewish organizations like JCCs to offer plant-based options or to convert their whole kitchen to plant-based, even better than
Yeah,
that. And there are many that they've gotten to do that. Like I know the JCC on Staten Island just recently installed a kitchen and they offer plant-based meals to their people.
interesting. That's great. Yeah, that's great.
So, and then I wanted to ask you about if you're familiar with the challenge. The PCRM is challenging these dietary guidelines for Americans.
Oh, sure. Yeah, one of the things that the physician committee, as we looked at the guidelines, we were really concerned with just like, well, who is the people that put these together? What was the scientific basis that went into them? And as we took a look at it, we saw that, perhaps even though the guidelines may claim to be free of conflict of interest, but they really weren't. There are many people who put together the scientific foundation for the guidelines that have ties to the meat and dairy and also the fad diet industry, supplements and things like that. So you can't just say that you're free of conflict of interest. You kind of have to prove it. So that was troubling to see. So we filed a complaint with the Office of Inspector General at USDA and HHS, asking them to, take a look at these guidelines and making sure that they're free of conflicts of interest. That's something that I think, as much as we important the guidelines are, it's also important for them to be put together with some transparency. So that was something else that was kind of news to us is when the guidelines came out, who was putting them together wasn't clear until after they came out. So there is a process that's set up. There's a dietary guidelines advisory committee. This process is went forward over the past 2 or 3 years. The new administration came in and said, Dietary Guidelines Advisory Committee, thanks, but no thanks, and came up with their own makeshift committee. So there's also some concerns there that you really need to be transparent on the who. You need to be transparent about conflicts of interest, and not only just being transparent, you need to eliminate these conflicts of interest. So those are things that were of concern with us. That's kind of like a separate kind of way that we're working on the guidelines. We'd love to see them revised to be clear of conflicts of interest, but also if these are the guidelines that we have been given, then let's just make sure that they're implementing them properly to, like I said, whether it's National School Lunch Program or the WIC program, let's make sure that they're implementing in a way that's healthy and amenable to all.
Right, right. And something else that I did want to mention is, and there, according to the article from the Physicians Committee, there's like 8 of the advisory committee members who are from the Cattle Council or the Meat Council, the Pork Council, and the Egg
Hmm.
Council, and the Dairy Council. So they are either directly or indirectly connected to it. Um, and one of the things that I also wanted to mention is that, humans, being humans, are not one size fits all. And whereas
Hmm.
a plant-based diet is really the ideal diet for most humans, every person might have a different requirement for their vitamins or the amount of protein they need. So when you say, we recommend 60 grams of protein a day, for example, for a 120-pound person, some 120-pound people, particularly who are athletes or bodybuilders or something like that, they might need more. And that's kind of like something where the dietary guidelines need to be mindful of that is that some people absorb more vitamins or more protein from their foods than others. And these guidelines are suggestions based on an average person.
Hmm.
So rather than, and so if a person themselves notices, I need this vitamin, let's say it's vitamin D. Without vitamin D, I don't feel well. So they're going to go and take a supplement. Whereas someone else will be like, I get plenty of vitamin D. I don't need any. And they're fine. So it's kind of like, that's kind of one of the fundamental flaws in this whole dietary guideline thing is that not everybody is exactly the same. We're not, we are all people, we're all humans, but we're not exactly like cookie cutter.
Right. And I think I will say that the one of the things that the administration took on with this dietary guidelines, I think is noble, is trying to make the dietary guidelines easier for people to understand. And that there's something to that because I'm not a dietitian, I'm not a physician, I'm a policy guy. But we should make sure that the dietary guidelines can be read and understood by everyone. I do think the administration really took that to heart. They didn't just want some kind of wonky scientific document that you need a master's in dietary science to understand. Um, I think it can work both ways. You need a little bit of that, and you also need a little bit of kind of making sure everyone can understand it. But I think in that push to make it more accessible, a lot of the detail and a lot of the kind of flexibility was frankly lost. So in a way to make it clearer, I think it kind of reduced it a bit. And I think you're exactly right. It can't just be one size fits all. So that's not only one type of person, but it's also one type of diet. It's also one type of like, well, what does a meal look like? And what a meal looks like in my household with might be a little bit different than a meal that looks in other people's households. So taking a look at the cultural aspects of food that is really removed from this version of the dietary guidelines. So is kind of taking a look at yeah, I can kind of pick that out. So the latest version of the dietary guidelines, I think there was a real attempt to make it more easily read by the general public, and there's a lot to be said about that. But I think what happened along the way is that the dietary guidelines lost a lot of the detail and it lost a lot of the applicability that many people can use in their own lives. So like you said, it does come down to, is this a one size fits all? And it's important to remember that what is, a meal in one family may not be a meal for another family. What is good for intake of a healthy person of a certain age might be not be what is needed for someone who is in less than ideal health at a different age. So we think it's important that the dietary guidelines have flexibility so it can be more applicable in people's lives. And that comes down to culture. That also comes down to people's health, their age, all sorts of things.
Right, right. And like for example, the old one, the where it was the My Plate, which was the most recent one before this one, even though it didn't say number of servings or anything like that, it had the things were in different sizes.
Hmm.
But if you look at this one now, it's just like they just threw everything on the pyramid, they shaped it like a triangle and they said, "Here you go."
Right, right. And it's really hard for, people to take that because not even though they're made for people to be able to digest them, no pun intended, a little bit better, being a little bit more simpler. Most people aren't going to take the time to read the entire guidelines. They'll see that pyramid and they'll think, okay, I guess this is what I should be eating. And there's not a lot of guidance from that pyramid. So the My Plate, although there were definitely that wasn't ideal, because if you're talking about like cultural appropriateness, one of the things that was really odd about the My Plate is it had this little glass that was supposed to represent dairy, like a glass of milk. And in some households, there's not milk on the table because that's just not culturally appropriate. It's not what people want to drink or what they can drink. So there's a lot of ways to do that. It's difficult. And I don't think the inverted pyramid in this guidelines is really helpful. For a lot of different reasons, but it's definitely something people remember. So I will give it that. It is definitely something people responded to.
Right, right. And when it came to like before My Plate, there was everything was the pyramid and it was like 10 servings or 4 servings or and it made sense in the sense of like the heavier stuff was at the bottom, the most important stuff was at the bottom. And I feel like in this instance, a lot of people got confused, and that's why they were concerned because not only did they turn the pyramid upside down, but they didn't put the same things in the same places. Like
Sure.
um, this has meat next to cheese, next to milk and yogurt. There's some eggs. There's a shrimp right there. There's some fruits and stuff over here, which are right next to, oh, the fruits are mixed in with the vegetables. So that's a pear and that's that's lettuce and that's a tomato,
Right.
which some people think are a vegetable, some people think are a fruit. But it doesn't say how much of pretty much anything. It just says this is this. You want this,
Yeah.
you want this, and you want this. And figure it out on your own, I guess.
Right. And, there's like a whole turkey there, versus one stalk of broccoli or like carrots. Not, the foods aren't to scale, so it is an interesting representation. And it is something that, again, people respond to. But are you supposed to read it from right to left or up to down? There's not a lot of guidance into where it's coming from because uh, a pyramid inverted. So you don't know, is the bottom the most important? Is the bottom less what you should be eating? But then it goes to like a point, like are the points where you should be eating less? So maybe a little bit of guidance would have been helpful with it. But again, I think the key takeaway is people saw it and responded to it. So if they're having a conversation about these guidelines, I think that is a good thing. As someone that spends a lot of time working on the dietary guidelines as policy, it's good to see it in front of center in people's conversations because the other 4 years when we don't have the guidelines come out, they're not so front of mind for people. So I'll give it that. Definitely got people talking and interested about this topic.
Right, right, absolutely. Okay. So, and then if just for context, this was what we went away from.
Yeah, no, yeah, that's the My Plate.
Yes.
In PCRM, if you go to our website, you can see the Power Plate, which is we think is an even better representation of this. Instead of protein, which is kind of coded for meat, just kind of has legumes, and it doesn't have that dairy icon, which is kind of not necessarily needed. We don't need dairy. All of the nutrients found in dairy can be found in other sources. So, recommending people drink it is really just giving them more saturated fat and other issues. So why not just drink water? That's something that should be kind of part of any dietary guidelines, drinking more water.
Right. Right. And of course the things that would not be on this plate, which would be like exercise, One of them, the older pyramid did say, don't drink alcohol. It had like a little segment
Right.
in the left side that it said, don't drink alcohol and don't smoke cigarettes, which surprisingly, a lot of people still actually do.
Yeah, no, and even with the new dietary guidelines, um, they they kind of tried to play both sides with alcohol. Um, I think they wanted to, not be completely against alcohol, but they also didn't really tell you how much alcohol to drink. They just say limit alcohol, and that's not really helpful. You got to tell people one drink a month or whatever, whatever that is. Because everyone, especially when it comes to drinking, has a different idea of what moderation is. But we know that, alcohol is linked to a lot of diet-related disease, especially cancers are linked to alcohol. So it seems like the safest amount of alcohol is zero. So I think the dietary guidelines could be clearer about that.
Right, right. And for some people, moderation would be one drink a day. For some people, moderation would be a tiny bit a day, once a week,
Right.
something like that. So whereas everyone has a different idea of, and especially that's
Yeah,
cultural too, because there are some cultures where
exactly right.
they drink till they drop, like,
Right.
they
And
just do.
some cultures where they don't drink at all. So,
Right.
that's the kind of thing that we were talking about before is you want the dietary guidelines to be clear, you want the dietary guidelines to be understandable, but you also have to realize it's not a one size fits all.
Right, right. Well, I appreciate you taking the time to talk with us today, and I think
Yeah.
our audience will definitely learn a lot from this conversation.
Yeah, no, I appreciate it. I'm glad we were able to connect and then reconnect. So it's good to talk with you today. Thanks so
All right.
much.
Thank you so much.
All
Have a
right.
great day.
Yeah, you too. Thank you.
Bye
Bye.
bye.